Biotech is not a vertical. It is an enabling foundational technology that in the next 10 to 20 years will be as revolutionary as AI is today.
Welcome back. I'm your host, Gary Bolles. In this episode of Possible Futures, I talk with Dr. Tiffany Vora, scientist, educator, and Singularity University's fellow in biotechnology, about why biology is poised to be as transformative in the next decade as artificial intelligence is today, and how we can prepare for a radically different future of life here on Earth or beyond. With a background that spans pharmaceutical development, computational biology, global biotech strategy, and innovation at the intersection of biology and space exploration, Tiffany brings clarity to the science and urgency to the questions. Who gets access to these tools? How do we prepare for a world where we can modify life itself? And what does it mean to not just survive, but thrive in ecosystems we intentionally design? Whether you're a policymaker, a parent, or just a curious human being, this episode will help you see biology not as a subject, but as the operating system of our future. So let's dive in.
I'm just delighted to be here. Thank you so much.
I can brag about you, so you don't have to. She's an expert on genetics, genomics, systems biology, computational biology, CRISPR, the microbiome, longevity, biomimicry, agricultural technology, space biology, and more. She has undergraduate degrees in biology and chemistry from NYU, a PhD in the Department of Molecular Biology at Princeton University. She worked on cutting-edge drug discovery at Bristol-Myers Squibb. She's been a visiting professor at American University in Cairo, taught at the Department of Bioengineering at Stanford, contract faculty with EY, founder of a consulting company, Biona Science, and co-founder of Three Body Labs, developing thought leadership with the global impact. You're doing work with the Atlantic Council, Homeward Bound Initiative, Humanity in Deep Space, Explore Mars, which I want to talk about, Lifespan.io, Astrius, the nutrient chocolate company, and Graphene X, a line of graphene-based clothing. I'm trying to imagine how there could be anything more than that.
I take a nap, Gary. I take a nap and recover.
I want to go back to what grabbed your attention or drove your passions.
So when I was young, I was just really interested in how things worked. So I thought I was going to be a doctor. And then I joined a genetics lab when I was at NYU to do my undergrad research. And kind of the more time that went on, I got this itchy feeling that I was way more interested in what people didn't know than what they did know. And so I ended up, after a big kind of internal struggle, realizing that the future for me was a PhD and not an MD. So it was a really interesting time because when I started as an undergrad to be a biologist, you basically needed to add and multiply. You didn't really need more math, and you certainly did not need to know how to program. And then suddenly I was thrown in on the deep end on this field that, we were building the airplane while it was in the air, and suddenly realizing that I didn't have the basic tools that I needed in order to be able to do this really disciplinary science. So then everything was hard, but it was good and it was smart and it was exciting. And I was surrounded by really smart people. NASA funded my graduate research, actually, and it was also at that time that I got involved with some space stuff, doing Mars simulations, if you want to talk more about that. But it all just led to this realization that biology, even 20 years ago, was so much more powerful than anything it had ever been. And it felt like such luck to be there right during that time, which is super uncomfortable when you're in it. But if you're paying attention, you can see that everything is about to change. And now 20, 25 years later, boy, have things changed. And today is the most boring it's ever going to be, which tells me I'm still really grateful every day to be a biologist.
What a tremendous gift for you to be there. To some extent, the separation between so many of these disciplines, biology and space, and so there's a little bit that's almost artificial, right? You have an amazing range of interests. Do you find some of the greatest insights are at the intersections of these different arenas and disciplines that you know?
Absolutely. And I would say that those intersections are the least comfortable place to be. And so that's the signal that they're interesting. I was lucky in that when I was starting graduate school, this computers, physics, biology thing was really starting to happen at that moment. I remember when I took my first computational biology course at Princeton, it was a disaster because half the people in the room had a CS background, half the people in the room had a bio background, essentially no common language and no way of talking about problems the same way. And I think it was in that class that I really started to understand the importance of words and framing in culture, in science, and in how we investigate the world around us. I hadn't really appreciated that before. But when the day I realized that the way the CS instructor was using words was not the same way that the bio instructor was using the same words, I was like, oh my God, like we're not coming at this the same way at all. And I need to be able to grow my comfort zone to take something from this other perspective that's very foreign to me at this point. And Gary, I'm going to tell you a truth. I am not a good programmer. I can do it, but like it's not native to me. I didn't grow up thinking that way. You hand me a biological system, I'll take it apart and put it back together for you, no problem. And when you're talking about this intersectionality, I think one of the mistakes that we make when we think about biotech, and I think this is true with other technologies as well, is we tend to think of it as a vertical, but it's not a vertical, it's a foundation. And that's why it's comical when you say all these things that I'm interested in. But to me, these are all things that rest on the same foundation. And that foundation is the biotech revolution, right? And so whether we're talking about medicine or agriculture and food or energy or materials or space, to me, it all rests on the same foundation, the same radical change we are experiencing today in the tools and technologies we have in order to use life as a technology. And then when you start bringing in AI and quantum and additive manufacturing and all of these things, like, again, I don't know how we can be thinking about verticals. It's a suite that whatever interests you today, you should take the tools that you've got and see what you can do with it.
That sparks two things for me. Our colleague Raymond McCauley is fond of saying biology is technology. But in earlier times, I've always thought of biology as relatively immutable. It's what nature decreed, but technology is mutable. We had the hacker Pablo Holman on a video talk a while back, and he pointed at a cell phone and he said, a user asks, what does it do? But a hacker looks at it and says, what can I make it do? So do you look at biology and you say, what can I make it? How can I make it act more like a technology? Is that just this part of this sort of new foundation that you're talking about?
I think that is part of it. I'm also grappling with what you said about nature being immutable. If you believe in the theory of evolution, by definition, biology has always been changing, right? And for at least the perspective that I bring to this is that's fantastic because what that means is that nature, life, has been innovating on this planet for 4 billion years, which means that we have tons of these tried and tested innovations that have lasted for 4 billion years that we can then use as building blocks to solve particular problems that we're interested in solving. And that's from the atomic level to the molecular level, to the cells, to organs, to individual organisms, to species, all the way up to ecosystems, right? We're able to access life's innovation process at all of those points. And now, thanks to our tools, we can do that in a way that is faster, more precise, and more accurate, more cost effective than ever before. The other kind of exciting thing is that biology still has a lot of surprises for us in a way that even though I am occasionally surprised by my iPhone, I am not stunned and shocked with a sense of awe with my iPhone the way I am with biology every single day. So that's the other good news that I have to share is that we are nowhere near mining out what we can learn and what we can grow and what we can innovate from biology.
So speaking of insight, you were recently a part of Singularity program focused on the future of biotech. Can you just give us one or two key insights that were takeaways for you from the event?
I felt like we had a diversity of perspectives triangulating on several really key things that sound very simple, but I think are really enabling. And so as someone who thinks about the future, and I always come from a place thinking I'm wrong. Like whatever I think about the future, All models are wrong, right? Some are useful. So hopefully some of these insights are actually useful. And so seeing a bunch of us kind of landing in the same area was really important. One of the most important insights, which was really the insight that motivated Singularity to do this program in the first place, is understanding that biotech is not a vertical. It is an enabling foundational technology that in the next 10 to 20 years will be as revolutionary as AI is today. AI has been going on in the background for decades and people have not been talking about it. And then suddenly, poof, ChatGPT, and then everyone's, oh my God, there's this AI thing, right? And the rest of us were like, wait, what about natural language processing and semantic analysis and like all of these things that we've been doing for years? But suddenly there was that light bulb moment, right? With generative AI and LLMs. That's what's going to happen with biotech. I can sit here and I can tell you all day how astonishing biotech is today and how much better it's going to get. But until your lived experience, your actual life radically changes because of it, you're not going to internalize that and understand it.
One of the sniff tests is, can you live without AI? Yeah, probably. Can you live without biology? I don't think so. I think you're stuck with it.
I think every single expert, no matter what they talked about, whether it was neuro, whether it was ag, whether it was food, whether it was synbio, all of these things, we all talked about trust and public perception. We all believe that not only does this tech work now, but the tech is going to continue to work in the future. The tech is not the problem here. The problem is how we feel about this technology. And there is something about biotech, and I can hypothesize for you as to what that is. People respond to biotech in ways that they don't respond to solar panels or self-driving cars. And one of the main things I think is this is stuff we put in our bodies or we put in our children's bodies. And that carries a level of emotional baggage that if me, Tiffany the scientist, I'm only thinking with that part of my brain, I'm going to miss something that Tiffany the mom or Tiffany the sister or Tiffany the daughter would have been saying if I was allowing her to talk. You can invent any product or service you want, but if the market isn't going to use it, it doesn't matter how good your tech is.
Right. People often might not have a tremendous amount of exposure to the science behind it, but they have an opinion. So let's talk a little bit about that possible future now of DNA modification. So they help the listeners and me just understand some of the mechanics. I get it that basically our DNA contains instructions, the building blocks for our genome. Help me understand how those modifications work. If you modify a few DNA cells from an organism in a lab and you inject it back into the organism, how does that propagate through the body, or how can you actually change DNA?
There's a bunch of ways to do it is the short answer. So again, as Gary mentioned, if you think of computers as storing information as zeros and ones, life on Earth stores information as A, C, T, and G, which are the building blocks of this chemical molecule that we call DNA. So you can think of the DNA as the source code, and think of it as source code that gets compiled and executed by your biological systems. So I have a couple of options of ways that I can change that source code. So I can either change the source code itself, the permanent genomic DNA level, in which case you've got a problem, right? Because what you pointed out was really quite subtle and important, which is what I'm trying to tease apart. If I take cells from your body, Gary, and I take them to the lab and I change ACTG and I do whatever I want, maybe I put something in, maybe I take something out, maybe I turn something on, I turn something off, whatever it is. And then I put those cells back inside you. The edits that I made are only in those cells, right? And that's either a good thing or a bad thing. So one of the things that has really challenged genetic engineering for the last 50 years at this point is that problem, is that delivery problem. How do I actually get the edits to the part of the cell where I want to go? And the way we've gotten around that is by really clever science about doing things like using a virus that targets that particular cell to deliver the edit that you want to just that place. So that's called gene therapy. Hits and misses with that. It's still an evolving technology. I wouldn't write off gene therapy today. But again, that's using the virus's capacity to precisely target a cell. So biology already solved that problem. We didn't have to solve that problem. So again, that's building on life's edits. But what if I really want the trillions of cells in your body, every single one of them, to have that edit? Well, the only way I can do that, and even that's not for sure, but the only way I can do that is if I catch you when you're an embryo. If I catch you when you're a sperm, I catch the egg, I catch the sperm, I make the edit then, and then from the time that you are one cell, and then two cells, and then four cells, and then eight cells, then at least in theory, every one of those cells carries the edit forward. Otherwise, it's hit or miss, and you're what's called a mosaic, meaning you have a mixture of these cells inside you. Now, that is an issue if what you want is a permanent change. But let's say what you want is a temporary change, or you want like a patch, like a software upgrade, essentially. Then we've got a whole bunch of other systems that don't target the DNA, that's the source code, but instead target the compiled code, which is RNA. And so that's things like RNA vaccines, which are amazing. And most people probably don't know this, but RNA vaccine technology was not invented for COVID. That has been under development for decades for cancer, so that your body, your own immune system, can be fighting cancer inside your body. And it turns out you don't just have to use the technology to train the immune system. You can use that mental model of the body being the hardware that boots up the RNA code, the software, in order to make things like, let's say you're missing some key component that is causing you to have heart disease. I could give you the shot and then your body can start making it. There are companies doing things like this right now. So again, it's taking advantage of biology's information storage capacity, manufacturing capacity, all of these things, which biology just does in order to fill in the gaps. And the third category that I want to point out as well then would be the category where you are making a permanent change, but you're not trying to do it in every single cell in the body. And that's where we're seeing gene editing therapies happening today, not quite a year and a half ago. First, the UK's regulatory agency and then the US's regulatory agency, they approved the first gene editing technologies for a therapeutic use ever. So that's amazing. And the use case was to cure sickle cell anemia, not to treat it, but to cure it, to make it go away and never come back. And you didn't have to do that with embryos, which would be one very controversial way to do it. But instead, it's very clever. It has to do with changing blood stem cells so that you've actually got two copies of the hemoglobin gene, one that works when you're a fetus, and then one that works after you are born. And the fetal one gets shut off once you're born, and you only ever use the other copy. And in people with sickle cell anemia, it's that second copy, the adult copy, that's broken. So this very clever system turns the fetal copy back on. So you're not putting in anything new. You're reactivating something that you already had in your genome, but you weren't using. And so we expected, and we continue to expect, that these low-hanging fruit, where it's one gene leads to one disease, that we'll keep seeing these types of changes happen, whether they're permanent upgrades or whether they're patches. But most human disease is a complex mixture of genetics and environment. And so the better we get at these tools, the more we'll be able to improve other conditions that are not as simple as the ones that we're able to tackle today.
That's amazing. Now, I mentioned I want to talk about life extension, and you've given me the perfect jumping off point and talk about disease. So there's a researcher named Art Kaplan who wrote in 1981 that we should think of human aging as a disease. And now he's a professor at NYU, and he subsequently wrote in 2005 that aging is the consequence of evolutionary neglect, not evolutionary intent. And that if aging serves no purpose, then the notion of aging as a natural process might be mistaken. Do you agree? Do you have an opinion that life extension, that fighting that evolutionary consequence, is actually doable?
Of course I have an opinion. So let me unpack it so that you understand where my opinion is coming from. So first, let's take the first piece you said about evolutionary neglect. That's a really interesting point, and you hear more and more longevity and aging scientists talking about this. Evolution's prime directive is for you to pass your DNA on. Anything that happens post reproductively, evolution couldn't care less about. There's no pressure, right? Exactly. There's no pressure for anything to go on in your biology after the baby is born. Like you've done your work. And so evolution is not set up to keep us healthy through the end. It just doesn't care. Now, what's interesting in terms of this idea of it being inevitability is that for a long time, people thought of aging as entropy, just as things falling apart. But the more in the last decade in particular that people have actually looked at the biology of aging, it has become clear through the science that aging is not just things falling apart. There are a specific set of molecular and cellular processes. We recognize 12 of them. They're called the hallmarks of aging. I can tell you more about that if you want, but these are things that happen routinely over and over again as everything from yeast to humans ages. If one of those things happens, it drives the other things. And interestingly, if you change one of those processes, it also makes the other ones better. So that's actually kind of a weird thing. What seems to be the case with the biology of aging is that if I take something that is a hallmark of aging, say epigenetic marks, the chemical marks that lie on top of the DNA, and then I remove those marks, the other things get better too. So what seems to be the case is I've actually dialed back the biological clock. You are actually biologically younger according to these molecular and cellular markers that are what we're using today to quantify biological aging. And that implies something different now. So when people say, let's think of aging as a disease, there's a moral imperative there that says, we believe that if someone has a disease, we have a moral imperative to intervene, right? To not just let them suffer if there's something you can do. So there's a moral imperative there, but there's also a much more mercenary imperative, because if you start thinking of aging as a disease, then all of the scientific funding that goes to disease mitigation, that becomes unlockable, right? Looking at it the way we would look at a disease, figure out what goes wrong, what's happening in the molecules, what's happening in the cells, and then find something that changes those in a measurable way. It's not just throwing your hands up and saying, oh, I guess I'm just going to have wrinkles and my back is going to hurt. It's no, let's decide. And this is, I think, the key thing that has to happen first. Let's decide on a gold standard set of markers, things that we can measure, so that I have a way of telling if my science is working or my medical approach is working. Because if you use death as an endpoint, that's a really lousy clinical trial, right? That's why I think today's movement to start viewing aging as a disease has some level of scientific underpinning. Not everybody's in agreement with that. But to me, it's a mindset shift that makes a whole bunch of other transformations possible.
Let's frame that in a possible future. And let's say we crack this code, right? So there's two dynamics I wanted to understand. So first off, so that we dramatically extend lifespan. So societally, we're talking a lot about biotech and the science of it, but societally, how do you think about life without death from illness, or just dramatically extended for the billions of people on the planet?
So there's actually two concepts that you're conflating. The first is health span, and the second is lifespan. Lifespan is the number of years that our hearts are actually beating. We've already doubled the average human lifespan in the last 100 years. It's one of the most amazing things humanity has ever accomplished, and we almost never talk about it. Stephen Johnson wrote a wonderful book about this. I highly recommend it. So that's lifespan, keeping your heart beating. We did two things, right? We helped with that whole infant mortality thing, but also what we largely did was pack a whole lot of years on to the end of life. I think we all have had experience with people that we love who their bodies have gone on in ways that have caused them pain and loneliness and fear and all kinds of suffering. And I don't know many people who want that outcome. Some of this is a little generational, right? Some people have been culturally or generationally trained to believe, no, the heart beating, that's what actually matters. The second piece is health span. And health span is the number of years that we are happy and healthy and productive. And You get to define health span how you want. I have my own definitions as well. But so when I am working with groups on thinking about what this looks like, I encourage us always first to think about radical extension of health span. Then we can have a couple of beers and talk about radical extension of lifespan, because that's when stuff gets really weird. So imagine a future in which the global median lifespan goes to 120 years, right? So that means half the people live to be older than 120. You should have a lot of questions about that, right? For example, if you are going to live to be 120, can you retire at 65? I would argue you cannot, financially, for one thing. But also, if your health span is still improving, then you're healthy and you're pain-free and your mind is still working and you're able to keep contributing. I always ask people, what does aging look like? And they're like, wrinkles, my hair is gray, my knees hurt, my back hurt. And I always have to challenge the room and say, what is something positive that happens? And then finally, one little voice in the back will go, wisdom? And I'm like, yes, yes, wisdom, expertise, excellence, like all of these things grow or have the potential to grow over our lifetime. Wouldn't it be wonderful if I got another 60 years of that? 60 years to be even better. You remember a couple of years ago when President Macron in France tried to nudge the retirement age up in France and the country went up in flames? Just a little bit. And when I saw what he was doing, what I saw was someone not moving fast enough or far enough. And yet the pushback was so strong that they had to stop. Contrast that with Japan, which over the last few decades has been edging their retirement up. Now, their social cohesion in Japan is quite remarkable. So in addition to the biotechnology of actually making it so that my heart is healthier and my brain stays healthy and whatever, I can replace my corneas and replace my knees and do whatever I need to do, the biggest change has to happen in my mind and has to happen in my mindset and in the systems and the processes that we surround ourselves with societally.
So much of my focus is on the future of work and learning. That's what a lot of people really want. Wave the magic wand. If I could do anything, what would I do? And that's often what the code for retirement is. I had a great conversation with our fellow, Emmeline Pat Dahlstrom, who's focused on space. So that'll give us a nice jumping off point to talk a little bit about some of your thoughts on Mars. We talked about what I call the Elysium scenario from the movie where the rich orbit the Earth on a satellite. And they all have life extension technology and they can fix any disease, any problem, where the people down on Earth are living in squalor with no access. Is that a possible future? Maybe not the satellite part, but certainly just these technologies that we're talking about, 120 years, that could be potentially available to just a small percentage of the billions of people on the planet. And not everybody has access to that kind of extended life.
Of course, it's a possible future. In fact, I would say it's an actual present. Already today, socioeconomic status determines your health outcomes in ways that nobody wants to really face. In the United States, for example, your zip code is one of the greatest predictors of your health outcomes. And zip code is a proxy for socioeconomic status. Today, if you have money, you're more likely to survive your cancer. You're more likely to know you have cancer. You're less likely to have heart disease. You're more likely to have clean air, clean water, safe cities, all of these things. That's already happening. What you're painting, which I think you're pointing to, is a much more extreme version of that. That is not a possible future that I'm interested in. So what I want to see are the innovators, the business people, the community leaders, the families, the moms and the dads and the kids who are looking for the decisions we can make today that are going to bias us towards a set of futures that are more positive and away from those Black Mirror futures. That's one of the reasons, for example, that I like the idea of unlocking federal funding for aging and longevity research rather than just leaving it to the private sector. Private sector is doing great work, but I worry that biases us towards a much more commercial, and if you can afford it, you can have it and maximize profits. That's Tiffany's magic fantasy anyway, that at least with some more public funding, these other things become possible. Can I add one more thing about that?
Absolutely.
I also think it's important to have these be opt-in systems rather than opt-out systems. I worry sometimes about authoritarianism and these types of technologies and biotechnologies for that. I would love for people to be able to choose whether they live to be 120. And if they don't choose to do that, to still be able to live their lives and die their deaths with dignity and without suffering. I think both things are possible.
Yeah, absolutely. And I think the possible future that we both love is where people do have that choice. You're right. We haven't solved anything near the disparity problem today, and we have the potential to widen the gaps. So these therapies, the more we can make it where people have these choices in their lives is critical. I want to talk a little bit too about space tech because you had brought it up, but I wanted to make sure we're also sort of, as we talk about these possible futures, anchoring it in some of the things that people can do, good decisions they can make, especially in the context of their own organizations, or ways to be able to leverage some of these advances. You did research on envisioning a potential Mars future for humanity. And what are some of the cool technologies or advances that fascinate you that could drive some possible futures? And then let's talk a little bit about how people anchor that in today.
So, through my work with Explore Mars, I ran our first Mars Innovation Workshop, where the theme of the workshop that I designed was how do we deliver value on Earth today while still innovating for a thriving human future off Earth? And the reason that I'm interested in this is I think there is this narrative out there that every dollar you spend on space is a dollar you could be spending to solve problems on Earth. That is a false choice because in my mind, these are the same sets of problems. If you're talking about renewable energy, if you're talking about governance, if you're talking about education, if you're talking about food security, water security, clean air, these are all the same problems. If a post-petrochemical world, right? No petrochemicals on Mars, so you don't have a choice. Like you've got to solve the actual problem. Space is a forcing function in my mind for actually solving the problems that here on Earth are too complicated or too difficult or too expensive or whatever it is. So I really want to break that false choice that people perceive. It's simply not true. When you ask me what tech I'm interested in, I'm not going to tell you that like ion propulsion technology is like the thing that lights me up in the morning. No, it's totally not. It's still biotech. It's still biotech. It's all of these things that become possible to put them together in new ways when we're starting to think about the more extreme environment of space. Because if we have humans in space, we're humans, we're going to take all our problems with us. In fact, that's what I told the NASA chief technologist a few months ago. I was like, the tech is not your problem. People are your problem. That's the problem. Yeah, the rockets are going to work. That's going to get solved. The rocket's going to get worked. Navigation's going to get worked. All of this stuff is going to get solved. But there's a big difference between surviving and thriving. And I want to see a future in which humans are thriving because living on Mars is going to be hard, especially at the beginning. Boy, is that going to be hard. It's not going to be great, especially those first couple of missions. So let's learn as much as we can about what is likely to happen to humans biologically, psychologically, engineering wise, all of these things off. And then let's make sure that the solutions that we're building to solve those problems are also helping us here on Earth. So you made the space longevity connection. There's two interesting connections there. The first is that actually a lot of the pathways that go haywire once you're in microgravity and exposed to ionizing radiation and all of this stuff, those are actually a lot of them the same pathways that are the biological pathways of aging. So potentially there's knowledge transfer there and you get a lot of added value. And the second thing to your point about radical life extension is that there are some people in the longevity community and some people in the space community who think that actually radical life extension is necessary if humans are going to become a multiplanetary species because it just takes too long to get anywhere. For me, the technologies that I'm interested in space are the same technologies that I'm interested in for Earth. And I really want to grow the stakeholder community of folks in space so that they understand whether they're students, whether they're startups, whether they're big companies, that there's a place for them in the future of space And I'm here to help them find that place.
Now, part of what fascinates me, what you were saying, is I just had a completely different picture of just the problems that we're trying to solve. We hit this complete context shift in between scarcity and abundance. On Earth, we've got abundance of air and water and space. No, scarcity. But space has a lot. There's a lot of minerals out there. There's a lot of those building blocks of these things. And so that reset button just forces a mindset shift of trying to figure, okay, so how do we rejigger a lot of these things? And then how do we leverage this broad range of exponential technologies and mix them together in new ways?
Right. And so you might not think you're a biotech company today. You might not think you're a space company today. That's fine. Don't try to solve all the problems. Instead, look for other organizations that share your values, share your overall goals, and have these complementary expertises. And then you have a way of working together in a pre-competitive format that enables you to build faster together.
So this sounds like marvelous advice for young people, either those who are listening or maybe parents who are listening. And I get this question all the time related to the future of work. How would you advise a young person, especially, to be thinking about what they need to learn or do now to prepare themselves for that possible future of so many exponential advances?
I think the first thing that I would tell them is that lifelong learning is going to be key to their journey through life. And so if they are still at all holding on to the idea that you're going to go to high school once and you're going to go to college once and then that's it, you'll be good to go from there, they need to let that go, like as soon as possible. And in fact, I'm sure you think about this as well, this mindset that we've all been growing up in, that there's 3 stages to life, right? Like you're young and you get your education and then you work and then you retire. I don't think that's a thing anymore. I think what we're going to see is something more like this, where I peak out and whatever that looks like. I'm tired. I've attained mastery. Whatever. Can't be more than a CEO, like whatever it is. And then I move back down into an educational place where I figure out, what am I interested in? What do I need to learn about? What new tech do I have to learn about? And then I go up the curve again. That's one thing that I really encourage young people to realize. And so one of the things that I like about that mindset is that it doesn't put pressure on a 17-year-old to know what they're going to be interested in for the rest of their lives, which has always seemed ridiculous to me, but is what we've been doing. And I guess if you were only making a decision for the next 30 years of your life, you could live with it. But now we're talking about, you don't have to do that anymore. You don't have to just live with it. So I think that's the first thing I would advise. Another thing I would really advise is being very careful about your signal to noise ratio. We live in a world that is incredibly full of noise, and that noise has managed to convince most people that cutting out the noise would be a bad thing. Then you're a loser. Then you don't get it. You don't understand what's going on. I have spent the last 2 years in particular really working on my signal to noise ratio, and it's something I wish I had done sooner. So knowing what information is worth listening to, what voices are worth listening to, and even if you listen, then what do you do? How do you think about that information? How do you engage? There's all this pressure today to be louder and faster. I would argue a life of intentionality is the opposite of those two things. So if you can start learning about digital detox and digital mindfulness and all of these things, this is like the worst thing you can have for your future if you're not approaching it mindfully. All of these things to slow down and to do more with less, I think is going to be really helpful for you when you're young in learning how to learn, learning how to question, and learning how to think. And that is the single most important skill set I think you can have for your whole life.
Brilliant. You talked about the mindset of the 3 phases of life and that sort of thing. And I think that's just gotten so baked into especially Western culture. But it's helpful to just think about instead as a relationship with work and a relationship with learning and a relationship with leisure. And if our lives do continue to extend, we're going to need to exert those choices and that power again and again. And you're exactly right. The earlier we can help young people to build that skill set and mindset, the more effective they'll be in an exponential future. The last question. So future Tiffany in 10 years, 15 years? It's 2035 or 2040. What would future Tiffany tell us a day in her life looks like?
Well, okay. So I think future Tiffany is going to be like, everything is going to be okay. Somehow or another, you're still here. Your mind is still sharp. You're still doing the things you really care about. You're not in any pain. Yeah, you've done some medical stuff, but that's okay. That was an opportunity. That's how you can keep you get to go outside in nature every single day and it's still beautiful. You're still growing your mind and you're growing your influence. Every day you talk to the people that you love. You're still in touch. You still care about each other. They're healthy too. Sometimes you see each other, sometimes you don't, but the love is all still there. And most importantly, past Tiffany, all of those concerns that you had, all of that time that you spent trying to get people activated to solve the problems, every minute of that was worth it. Because now we've got billions of people who understand how important this moment is and they're doing something about it. If I am looking at my absolute preferred future, my preferred future is one in which we live in a beautiful, vibrant, healthy ecosystem on our planet where the biodiversity apocalypse is being slowed, if not stopped and reversed, where I can still swim out to a coral reef. Honestly, Gary, I'm not sure that's going to be the case, right, in 15 years. And I have access, or a glacier. I was just in Antarctica, right? That's definitely top of mind for me. I have access to that healthy, delicious, safe food. And also, by the way, thanks to biotech, all kinds of new tastes and flavors that didn't even exist back in past Tiffany's 2025. I want to see a world in which, again, like we're not just surviving, but that there's genuine delight. We can have delight in our bodies. We can have delight in the world around us. We can have delight in the mind. That's still a possible future. That's what I want to see.
Thanks for taking the time to step into the future with me. I hope you enjoyed this conversation, and we'll be back next week with Jaya Balu, one of the most respected voices in cybersecurity and quantum strategy, about the invisible architecture that keeps our digital lives safe and why it's all at risk.